Right now, we're joined by Dr. Jeffrey Potoff from UW Health. So really quickly, how far are we on getting children under 5, which is the only group in the U.S. not eligible for a vaccine, vaccinated?
The quick answer is I think those vaccines may be available in July. Right now, we have preliminary data from Moderna, who's going to seek FDA approval, and even more recently now, data from Pfizer. They're also going to seek approval. That meeting will happen in June, and we'll likely see one or both of those vaccines approved for those youngest children sometime this summer.
And how accessible is the vaccine for kids 5 to 11? For parents out there, is it easy to get?
It is fairly easy to get, maybe not quite as ubiquitous as the adult vaccine, just because they are different doses. But in my own experience with our daughters, we were able to get an appointment to get them boosted within a day or two of looking online.
And of course, we were talking about those summer months, traveling season. We're approaching Memorial Day, and that COVID transmission rate in Milwaukee County is sitting at high. What's your advice for families?
Yeah, I think it's a good idea to look at that CDC map to see, what is the COVID transmission in the area that you're visiting, and then, do some self-reflection and look at your risk. Are you all vaccinated? Are you boosted? If you are, it's still possible you could come down with COVID. So, weigh the risk of, having some symptoms for a week or so. But if you're high risk, say immunocompromised, you're a transplant patient, you're getting cancer treatment, I might avoid those indoor crowds with large numbers of people in those areas that are yellow or red, just so that I don't take that chance of getting the disease and having a poor outcome.
Now, I wanted to get your opinion on this. Moving forward, if you test positive for COVID, is that isolation period still going to be the same? I know if it's been altered a couple times, but those days of caution, is that a rule set in stone? Could we, see that go down to 3 days possibly? What do you think?
Yeah, I feel like with COVID, nothing's set in stone. But the current recommendation is if you test positive for COVID 5 days later, especially if you're not having any symptoms, you can go back into society if you wear a mask. Now, many of us would recommend that at that 5-day mark, you take a rapid antigen test, not a PCR test, because that PCR test will likely still be positive. But if you take an antigen test, and you're positive at day 5, it's a good chance that you're still contagious. We'd suggest those folks then just stay at home for the 5 additional days. But at day 5, negative antigen test, still wear that mask because some people are still going to be contagious, but you can kind of get back out there after day 5 if you're wearing a mask for day 5 through 10.
And what's the easiest way, last question really quickly, to stay on top of everything? I know we've kind of talking about isolation periods and the CDC changing the guidelines. It can get a little bit confusing. What do you recommend people do?
I agree. This can be confusing. I usually go to either the state Department of Health website. They'll usually have information, or the CDC's got a pretty good process where they lay out some of these guidelines, this information on their website. So you can kind of understand, is it 5 days? Is it 10 days? Do I need to worry if I go to, say, Racine County or not? There's some good information on those two websites.